Doctor, thank you very much for joining us. What did you make of what the President said about the virus and how the peak, which is, if we're not in it, which is coming, which is imminent, could be longer than what we've seen before?
Yeah, thank you for having me this evening. Yeah, I think the President was quite right in doing the country, taking it back to a level 4 restriction, and also to give the health system and the hospitals time to recover. The government also need to manage the economic fallout that we currently see in the country. I think it's only a temporary measure and should really be a preparation for more permanent solution, which obviously is vaccination. We need all vaccinations in the country at the moment, and these are vaccines that are shown to be safe and efficacious, as well as proven to be of quality. And we do need to have these vaccines being rolled out as soon as possible. So rollout of many vaccines should be happening as quickly as possible to protect against hospitalization and death. And we need to stay ahead of the virus in the country.
Well, we're barely struggling to keep up, so staying ahead is going to be almost impossible, isn't it? Let's talk about the Delta variant a bit more. The President is very concerned about it because it's apparently more contagious. You say that we need to get different vaccines into the country. That is correct to fight this variant, isn't it?
Yes, that's absolutely correct. The President also mentioned SAHPRA. I think you've spoken about SAHPRA just now in your interviews. But SAHPRA is the body that looks at approving vaccines in terms of quality, safety, as well as efficacy. And that is to give public the opportunity to know that all the vaccines that are currently being approved in the country is evaluated for quality, efficacy, and safety. So the vaccines that are currently under scrutiny by SAHPRA is the Sinovac vaccine as well as Sputnik. And we believe and we're very confident that SAHPRA will do its job without fear or favor, and that SAHPRA will look at the data, the dossier that has been submitted by Sinovac in terms of the efficacy, in terms of the variants, and in terms of the quality and the safety of the vaccine. And we also are very confident that now, since the WHO has approved Sinovac and has been rolled out now in many different countries, that the reliance review will be applicable to Sinovac dossier being submitted here in the country. And Sinovac has been proven to be efficacious, a good vaccine, works against the variants, and I can talk a little bit about the Delta variant and the Sinovac vaccine as well as other vaccines. But we're very confident that SAHPRA will look at it favorably and will do its job without fear of favor, and in terms of approving the vaccine now that the WHO has also approved it.
So in terms of sorry, excuse me, jumping in there, that AstraZeneca is pretty effective in fighting this variant. I mean, while we play catch-up, we also hear that a few more beds are being released, 800 and 400 in certain other areas. Is this going to be enough? Are we capable now of tackling this variant as it spreads rapidly through the population?
Yeah, so in terms of the Delta variant, it is a very contagious variant, and we do know that the vaccines that are currently, like the AstraZeneca, the Pfizer vaccine, has been looked at in studies in the UK and have been found to neutralize the Delta variant. So in terms of Sinovac, we have just received information this afternoon, preliminary data from Sinovac, which have shown that the vaccine also is able to neutralize the contagious Delta variant. And that has been proven now in immune sera from 13 people that have been vaccinated, as well as from convalescent sera, implying that the vaccine is effective against the Delta variant. And therefore, it's important that all vaccines that are currently being shown to be safe, efficacious and of quality be approved and rolled out as soon as possible. We need all vaccines in the country to be rolled out, and this should be happening as quickly as possible to protect against hospitalizations and death. Most vaccines are 100% effective against hospitalizations and death, and therefore it is important that the vaccines that are currently available should be rolled out as quickly as possible. The public has seen issues of the virus variants and has seen the rollout issues, how slow that has been, and therefore it is important that all vaccines that are currently available in the country should be rolled out as quickly as possible. Because if you don't have vaccines, you just get variants that are going to be, the virus will mutate and you will just get more variants that will pop up. All vaccines give protection against the variants, but they're not all 100% effective. So one will still get some breakthrough infections. We just don't have that silver bullet vaccine, but at least vaccines will protect against hospitalizations and death. And that is what one wants to prevent during a pandemic. It's hospitalizations and death.
Thank you very much for that, Dr. Sanet Aspinal. He also highlighted, the President, that if you've got if you had the coronavirus in the first and the second sweep, that you don't have those antibodies that can protect you against the Delta virus, which is obviously concerning. I mean, both you and I had it.
Yeah.
But we have to be as careful as everybody else.
Yeah, definitely no protection, and that's the worrying thing. But the President also stressed to people that even if you did receive the vaccine, that you still can get infected again. Lots of people are confused about that, Jane, because when we saw the Gauteng Health MEC getting infected again for the second time, people were like, oh, but she was vaccinated.
Yes.
But what we need to realize is that the vaccine will now become like an antibiotic for the flu.
Yes.
You can still get the coronavirus,
right,
but it will protect you from serious illness, which is what we need to get used to.
Exactly. And I mean, if you look at countries like the US and Israel, the dramatic impact there already, because they've had so many vaccines, fewer people are dying.
Well, coming